Today I have the topic that cerebrovascular accident. I will tell you in detail what is a CVA, cerebrovascular accident. Secondly, what are the symptoms patients will face in CVA, and what are the prescribed treatment from the medical side, and what physiotherapist is playing role in this cerebrovascular accident. So here, what is the cerebrovascular accident or stroke or brain attack? This is the only when the blood flow is lost in the brain, and when the blood flow is lost in the brain, then the brain tissues, brain cells are damaged here in the brain, and that blood clot occurs. Then blood vessels they get broken. So like this situation occur. Mainly this is the loss of blood flow in the brain. Because of this, proper oxygen is not supplied in the brain tissues and they get damaged. And that's how the cerebrovascular accident. The vessels which are supplying blood flow to the brain, they are unable to work properly. How you can find out? How you can find out that patient is suffering from this brain stroke? Weakness, numbness are on one side of the body. Dizziness, you will find the patient feel dizziness, numbness, weakness on one side of the body. And he is facing the problem for writing, for talking, and for understanding the language. So, in this way, you can think. And what is the main cause for it? The main cause is blood clot, that is atherosclerosis, because of atherosclerosis. When the blood vessels are full of cholesterol, line or lumen of the vessels are blocked by the plaques, cholesterol, then the blood flow either less or stopped, lost in the brain tissues, and then the proper oxygen is not supplied. So, what we have to do in this, so how to find out, and see, I told you how to recover from this cerebrovascular accident. Main cause for it is high blood sugar level, high blood pressure, then these are the main cause for cerebrovascular accident, or Regarding, you can find out from the CT scan, MRI of the brain is done, then you will find small clot is there inside the brain. That, how to reduce that brain? Then in medical, mainly medical specialists, they will prescribe to you the medicine which recover or which uh, dissolve your clot, or surgery is also done when blood clot is more than the neurosurgeon, they remove the clot and patient gets relief. If it is less, then the medicines are there, they are injected into the blood and they dissolve the clot which is formed inside the brain, which damaged the brain tissues. So these are the remedies, these are the medicines, these are the things are done when the patients get cerebrovascular accident. So as soon as you find that a patient get numbness, weakness, or he is unable to speak properly, then you should immediately take the patient to the hospital where the diagnosis is done, MRI is done, CT scan is done, and medical, that is blood for cholesterol is done. Then there are so many investigations are carried out to find out the position of the blood vessel and cholesterol, blood for cholesterol is done. These all the things are done to find out whether the patient is really suffered from cerebrovascular accident, a brain stroke, a brain attack. So something has attacked on the brain, that is called brain attack. That blood clot attacked, and because of that attack, you won't get proper oxygen supply to the tissues of the brain. So now, what are the treatment prescribed for the cerebrovascular accident cases? Paralysis of one side of the body occurs. So in that condition, patient is unable to close his eyes properly. That is, this position is not done. Then sometime eating is not done properly. So whatever the things patient is eating, that dropped from the mouth. Whistling is not done like that. Is not done. Chewing, proper chewing is not done. Nostrils are affected in the face and here in the hand. Sometimes if stroke is very severe, then patient is unable to move the finger. A total movement is lost. Unable to move the hands. Then one side, the from which side are we say left hemiplegia or right hemiplegia. So hemiplegia occurs because of the severe cerebrovascular accident. So what, as a physiotherapist, we should do? Before giving exercises, we should measure the blood pressure. That hypertension, high blood pressure, if patient is having, then we should take care of blood pressure. We should measure the diabetes. If it is near about 140, then it's okay. We should have a glucometer. We should have a sphygmomanometer. By sphygmomanometer, we can measure the blood pressure, especially with the HG, not this all distal. They give error. Glucometer, we should measure the glucose blood sugar level, and then as a physiotherapist, we should start from the facial exercises. I will tell what are the exercises are to be done on the face. Make the patient sit on the chair. Tell the patient to close the eyes, both eyes, like this. Patient will not able to close the affected eye, so you can give him you can advise him to close. Your eyes is not closed, so he will try to close his affected eye more. Then making the wrinkles on the forehead like this. Hold it for some time. Close your eyes like this. Open your mouth in the correct position. Whistling like this. The whistle sound should come. Sound should come. Advise him to do like this, whistling. Then chewing clockwise and anti-clockwise. Then give the balloon with the attached with the one hollow things stick so that he can flow, can blow the air to the balloon like this. These are the facial exercises are to be done, are to be encouraged by the physiotherapist. Now come to the hand. Take the affected hand, place over the table, then start from this point like this, then middle. Then these are the passive exercises are to be done by the physiotherapist. This, 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 like this, then this, then this, then closing fist, making the fist. This exercise, You can see me how I am doing this. This. If finger movements are improved, you can do the resistive. You can give the ball, and you can give the ball and tell him to press like this, like this. You can give any soft object so that a ball he can press it. These exercises will improve the movement of the fingers, and then middle deviation and the lateral deviation. Then this moment and this moment. Then this flexion, extension of elbow joint. Then rotation of shoulder joint clockwise and anti-clockwise, up and down, sideways. Then here like this, we can advise him. In the same way, the foot of the affected side, that's toes movement. In the same way as you have done in this, see, these are the toes, you can do like this. 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 And then plantar flexion and dorsiflexion. This moment. Then middle, then lateral side, and then you can do the rotation also, clockwise and anti-clockwise. Then flexion of knee joint, extension, flexion. Then hip movement, that is clockwise, anti-clockwise. This movement you can do, and when blood sugar level and blood pressure level is within the normal limit, you can take the patient for walk. Walking exercises will make the confidence, will enhance the confidence of the patient. Like this, you can, and support of the family members, they can enhance the confidence of the patient by giving love and affection to increase the patient's confidence. It is very important so that he will recover from the all loss. Then physically and mentally he will recover from the disease, and he will come back on the work. That is rehabilitation, occupational therapy, speech therapy, means telling him to speak the words, the pronunciation, speech therapy. Then occupational therapy, like encourage the patient to eat himself, write himself, doing some special work like lifting small things, keeping like this, lifting, keeping like this. Then moving himself, flexion and extension of the passive exercises are to be done by the physiotherapist. Then active exercises are also to be increased, which are to be done by the patient, and advise the patient relatives not to leave the patient alone at any moment. He may have the incontinence of urine, means पेशाब बार बार निकलना हो सकता है, इसके लिए प्रॉपर urinal to be kept by nearby him so that he can take, or patient's relative can provide the If urine is more frequent, incontinence of urine occurs, then catheterization for severe cases is done. These are the precautionary measures are to be taken because patients get recovery and that recovery is to be maintained at all level. Otherwise, patient falls down, then also it becomes the problem. Patient may have fracture on hip or in the hand. So after the recovery, it is to be maintained. Recovery is to be maintained by the relatives and by the patient both. So it is the responsibility. If it is a first stroke, then the chances of recovery is more and patient may get recover from this all disability and he may lead happy and prosperous life except residual deformity. Some deformity may remain. A patient goes second time stroke or CV, then he may recover or he may not recover fully. If it is third time, then there is a very less chance to recover from such a CV cerebrovascular accident, and patient may suffer from more serious problems. So it is our fundamental duties to look after the hemiplegic cases which have occurred from the brain stroke, that is cerebrovascular accident or brain stroke or brain attack. So I advised as a physiotherapist to avoid hypertension, to avoid diabetic condition. One has to be very, very happy in all the way. Consume less fatty diet, salt restricted diet, regular checkup of blood pressure, regular checkup of blood sugar level, fasting and PP at least once in a month. Then cholesterol checkup and patient if is having heart diseases, then regular medication by the cardiologist, medical specialist, and the opinion of neurosurgeon, neurophysicians are to be taken regularly. Hope my lecture on cerebrovascular accident, precautions, symptoms, diagnosis part of view will help you to lead happy and prosperous life. Thank you once again to my all well wishers. Thank you again and again. Please be healthy and wealthy both. Avoid hypertensive diet and diabetic diet so that you should be free from diabetes, either diabetes type 2 or type 1 or insipidus, whatever the blood sugar, and whether it's ischemic stroke or any kind of stroke of the brain stroke. So be healthy, be wealthy, have a regular checkup from the hospital. Thank you very much being with me. I am Dr. Santosh Silal, physiotherapist, retired from the Indian Air Force, and I used to be made physiotherapy department in charge, and I was in charge of physiotherapy department for 10 Air Force Hospital, Hyderabad, 7 Air Force Hospital, Kanpur, then 4 Air Force Hospital, Kalaikunda, and I am still advising my physiotherapy to the people through this video. You may get benefit of that. That is my the motto. Thank you very much being with me once again.